Okay, my name is Lauren Schlichting. It's March 5th, it's 3:30. I'm going to show how to do a wet to dry dressing change, and I'm going to identify my patient using two identifiers, and I'm going to introduce myself, wash my hands, and put on gloves, clean gloves. And I'm going to take off the dressing. I'm going to grab one of the corners and pull it off slowly, just like so. Throw it away in the biohazard bag, and then pull out the gauze. And if it's dry and sticking to the wound, all I have to do is get it wet so it separates from the wound. Throw that away. Change my gloves. Okay, so I'm gonna put on different gloves, and I'm gonna use some of the gauze that I would bring in with me. And you can either dip the gauze into the saline, or you just pour it on there. And you're gonna start from the center of the wound and clean out. With I use one gauze for one swipe, and I would use a different piece of gauze for a different area that I was cleaning. So same thing as before, just dip it or get it wet in the center of the wound, and then wipe out. Okay. Then I'm gonna take off my gloves. Okay, I'm gonna open my dressing change tray right here. And then I'm gonna put on sterile gloves. Okay. I'm gonna grab the inside flap right here. Slide them on. Okay, I'm gonna use my two fingers, grab the other glove. Okay. That away. And then I'm gonna use, this is a new pad that I'll put over the dressing whenever I'm done. And I'm gonna use the gauze that's inside here, and then I will place it inside the wound. If there's tunneling, I'll pack it back in the tunneling right there. Okay, so I'm gonna pack all the gauze, and I wanna make sure that the gauze isn't touching the skin outside the wound. I wanna make sure it's flush with the wound. And then I'm gonna put on my new cover right here. Then I'll use the tape in here. I'm gonna tape it in a window frame. So I'll strip out the tape, put on the side right there, right there, right there, and right there. And then I would initial it, and I would put the date and time. And then I would take off my sterile gloves. Okay.